Almost every single patient who comes into the hospital has some form of diagnostic imaging. Eventually, somebody in the hospital will make a pit stop by radiology, whether it's X-ray, CT, MRI, ultrasound. They will more than likely have a test with us to help figure out what is going on with them. When I get a patient, what we'll do is we'll get their information, introduce yourself, we'll have them lay on the table, make sure that they're comfortable, and then we'll go back into this control room. We'll pull up the exam, we'll set up parameters on what we're scanning. We do something called a topogram or a scout image to line up the images. And then once you're done doing your scan, you will do post-processing. So you adjust the images to what they're looking for. With CT, there's different planes of view. You've got your axials, your sagittals, and coronals, and that helps give the radiologist more information. That way they can diagnose the patient with what's going on with them. It's kind of silly, but I used to watch a lot of health shows. So House was really big when I was in high school, and every single patient had to go to do some form of imaging. And I thought, wow, what an important job, because they couldn't do any of their diagnosing without X-ray, CT, MRI. I had to do a 2-year program to get my X-ray. And then after that, I did an online course. It was about 6 months, and I also cross-trained at my job to get my CT credentials. And for both X-ray and CT, you have to take a registry for those. We have a lot of PRG meetings that they inform us of things that have been changing protocol-wise to keep everything up to date, to make everything consistent system-wide. And then every 2 years, you have to submit continuing education. So I use the ASRT. So it helps kind of keep your credentials and new information up to date. I feel like you need a lot of compassion, because you see some sick people who are sometimes on the worst day of their life, and you need to be able to make them feel comfortable, understood, and not that you're rushing them, because I know some people that are like, don't rush me, and you're not trying to do that. You want them to be happy and comfortable. And interpersonal skills, being able to communicate with people, and then some technical skills, like starting an IV, being able to master that fear of sticking someone with a needle. I was in a lot of the allied health classes in high school. I feel like those definitely helped, and I think I was a part of HOSA, which is a high school club that was a health occupation society. So that kind of gave you a little bit more background information of health careers. Helping my community. A lot of the patients, I grew up in Lincoln, so patients, you see them, you've seen them at Walmart or throughout the years, it's kind of connecting to your community and helping out those that you may not have known. It's really rewarding to see people progress and get better. It's a great career where you always are learning something new. Medicine changes pretty quickly, technology changes. So if you like to continue learning and not feel kind of stuck in one spot, it is definitely a career to go into.